Well, this week, Community Health Network and Inside Indiana Business hosted the third in a series of town hall meetings on the changing face of healthcare. Changes in healthcare today and tomorrow, held at Marian University in Indianapolis, and was a chance for the public to interact with leaders in healthcare, insurance, and education. Here now with a special insider segment on the ever-changing face of healthcare. I'm pleased to be joined by Brian Mills, President and CEO of Community Health Network, Dr. Paul Evans, Marian University's Dean of the College of Osteopathic Medicine, and Carrie Ann McGeary with Ball State University. And welcome one and all.
Thank you.
Brian, I'm going to start with you. The series, which we're so proud to partner with you on changes in healthcare, these town hall meetings, really a chance to interact with the community at large and talk about specifics, questions, concerns, and all those types of things. In your view, how have these events gone? I mean, there have been a lot of questions on the table.
Well, Gary, first of all, it's a delight to be here, and thank you all for sponsoring that with us. As we talked to consumers, patients, families, a year ago, you heard confusion and fear. What's going to happen to me? Will I have access to health care? And you hear that, and that's why we reached out to you all and then talked to universities and insurance companies and said, hey, can we put these series in place to hear the concerns, to provide information on what we know is happening, and to provide a forum for dialogue. So our purpose isn't to say we have all the answers, but it's to say we're interested in you. We want to know what your concerns are, and let's work through these issues together.
And those concerns, the questions, very evident. I know this week at Marian University, lots of great questions. Again, concerns, but also just questions about what's next, because there's a level of uncertainty. Changes have already taken place, obviously, but the question is what happens between now and 2014.
One of the big things that comes out each time is what's going on in Washington with health reform. And we're pretty quick to say that's really not the issue. Healthcare is changing the financing and the delivery irregardless of health reform. We believe that health reform has given us a sense of urgency to change what we do and try to change, improve the access, and change the cost structure. And that's what we're working on. So we're trying to make sure people understand we want to be here to provide your care, and we're trying to re-engineer the system to give you a better outcome.
A big change, a big event this week, Dr. Evans, the groundbreaking for a major project, the College of Osteopathic Medicine, first new medical school in Indiana in more than 100 years. It was a big event, a big day for Marian, but this is a project that stands to impact not only Marian, the Indianapolis region, but the entire state in many respects.
Yeah, absolutely. Our project is exciting for this part of the city. We will have 150 new medical students starting in August of 2013. We will obviously be in the process now of building a new center for health sciences. We were delighted to name the building after Mike Evans, who's been a very, very wonderful donor for Marian University. We think we're going to make a real difference in the city and in the state of Indiana.
Yeah, I'm going to get to Carrie Ann and ask her about to frame that in a minute. But in terms of this shortage that I think exists now, but certainly over the long term in terms of family practitioners, that's one of the real areas that this school will address.
Right. There is an impending shortage nationally. Best studies predict about 160,000 physicians being short in the United States by 2025. Indiana has its own shortage difficulty. A study done by the IU School of Medicine predicts that by 2020 there'll be 5,000 physicians short in the state, with 2,000 of those being primary care doctors. So we have a lot of work to do to help the citizens of Indiana to get better health care.
Carrie Ann, as you look at this new medical school, what's the impact that you see, the importance of this project?
Well, there's multiple things, and one of the primary things is the shortage. We do have a shortage of physicians, and with the increasing access that the healthcare reform has provided, that is going to increase the demand for healthcare services in the healthcare bill without anything really addressing the increasing needs in the supply side. So this is really going to address that very well. The other thing that they are uniquely positioned to do at Marian is rethink kind of what Brian was saying about the engineering of healthcare and how we deliver it. It's very important now that we take a step back and say this is no longer a treatment service-based industry. We have to look at the episode of care. That's how everything is going to be reimbursed in the future. And that means we're going to be working together in teams. So we're going to need not only more primary care doctors, but more nurses, more physicians assistants, lots.
Yeah, I want to get all your opinions on that too, but you mentioned the team concept, which is a change away from, I guess, what traditionally we've been accustomed to. How will that change for the patient? How will treatment be different dealing with this team concept?
Well, this is, from a patient perspective, I think a really benefit. This is going to be something where everybody is going to work together to address the overall patient's concerns and demands that their ailment is requiring. So you won't have just a doctor looking by himself trying to describe the diagnosis without working with another specialist and another person. Teams will be created.
Yeah, I think a major difference that may seem subtle, but we think is significant, is the fact that the patient's at the center of the delivery versus the system or the provider being at the center.
Exactly.
So the system needs to be re-engineered based around, okay, how does the patient access that? How do we reach out to the patient even before they try to contact our system? How do we engage them in their wellness? How do we make sure they have access to their record? How are we making sure we're all working from the same record? So it's a coordinated, engineered approach versus an episodic approach, which is what we've experienced heretofore.
And part of the setup, I know, at the new Marion School is not only will the College of Osteopathic Medicine, but also the nursing school will be in the same building, right? I mean, they'll basically train together.
And these concepts are exactly what we're looking at in the future. Medicine is changing. The skill sets for being successful in taking care of patients in the 21st century means you have to have those team-based skills, and we're going to put that into our educational component, not only in the College of Osteopathic Medicine, but also in concert with the School of Nursing, where in some instances we will actually have classes together so that the nursing students and the medical students will be in the same room learning these skills to improve their ability to care for patients.
What should consumers in all of this confusing to many people, complex healthcare reform situation, what should consumers be thinking about as this unfolds?
They should be thinking about ways to improve their health. And they should be thinking about the fact that this healthcare system has been really designed to treat them, but now we have to start thinking about ways of living better and how we should engage with the healthcare system, not when we are in trouble, but before then. We have to consider preventative care is very important.
Yeah, how will that, Brian? That's a good point. You hear a lot of talk about wellness and preventative care, and I guess perhaps reform maybe forces that issue a bit?
Yeah, we see it as evidenced by one of our initiatives, which is to go into local school systems and partner with those school systems to say, what can we do to educate your students, their families on everything from nutrition to exercise to wellness to other things, and saying, how do we work together? And making sure that they have access and education at that level. And that's not providing necessarily acute visits. It's taking care of them and their education and their own self-wellness.
Different as you look at students who will be coming in to the school, an opportunity to train them, I guess, in this new environment then.
Absolutely. Everything is changing. The culture is changing, the society is changing, the expectation of patients is changing. Actually, the students that are coming into the medical professions are changing as well. And so all of those things need to be put together so that we use these changes and eventually focus on meeting the needs of these patients who are very specific in terms of what they need and what they're looking for down the future in healthcare.
Again, more of a consumer-based question here, but we're in the political. It seems like the political season never, stops. But a lot of talk about repealing, about changes, about all those types of things in healthcare. What are the chances that there will be dramatic change in healthcare reform between now and in 2014?
Well, for a lot of the bill, mainly the main component of the bill was the increase in access. I don't think you'll see much change there. I'm not a politician, but my guess is most of the constituents 4 politicians want that, and they need that. And so for that to change, I think that would be probably less likely.
And from a provider standpoint, Brian, as you mentioned, you're going, full speed ahead, with what you're doing now. So the whole reform issue is kind of a secondary
And
issue.
I would hope that consumers, our prospective, our patients or people receiving care now would be comforted by the fact that we're sitting here talking about adding physicians and adding access points and re-engineering the system and putting the patient at the center, as opposed to closing off a system for patients. So I would hope that as people listen to this in our town halls and other things, they're comforted by the fact that we're trying to address their concerns.
All right, very good. A great conversation. Brian Mills, Community Health Network. Dr. Paul Evans, the Dean of the College of Osteopathic Medicine at Marian University, and Carrie Ann McGarry from Ball State University. Thanks very much.
Thank you.
Appreciate it.